So, in the earlier class, as we have discussed about the pelvis and the hip joint, right? The pelvis and the hip joint. In today's class, which we are going to discuss a little bit going further down, what we say? The knees, right? Knee pain, common problem nowadays, because we don't have an awareness how to sit, how to stand. What is the neutral alignment for my knees? How much pressure I have to create? Because knee is the very complicated joint, guys. This is the junction between the hip and ankle. If the mobility of the knee is affected, it affects the mobility of your hip joint and your ankle joint too. So we must have to be careful, and knee has a very limited range of motion that we call the flexion and extension, right? The flexion and extension. So knee joint has no any rotation over there. If you're trying to rotate it, ligament strain, meniscal tear, right? Overstretching of the tendons too. So many injuries. That's why in the alignment classes also, what the teacher asks that knee has to be 90 in this posture. It has not to be go beyond 90 degree. Because it has a biomechanics there, right? It has been designed in a different way. It has a limited range of motion. It is not that the same range of motion as we have in your shoulder and the hip joint. There is a maximum degree of movement we can use from shoulder joint and the hip joint. But the knee has limited range of motion, my friends. So let's talk about the knee anatomy today. So knees, when you're talking about the knees, let's talk about the happy knees today. So much pain everybody has to make it happy, how we can balance your knees. So let's talk about the bones first. What are the different bones that forms the knee joint? So the lower part of the femur, that is your thigh bone. Yes, this is the longest bone in the body. Then we have a tibia that we call shin bone and the fibula. So tibia into the center that we call shin bone and fibula on this side. Patella is your kneecap in the center too, which act as a pulley. The patella kneecap. So here we say this is the knee joint. Has been formed mostly by these three bones, the patella, femur and the tibia. So if we can look at here, guys, now the knee anatomy. So these are the bones that we can say, like here, this is the femur, this is the tibia, the shin bone, right? The shin bone is your tibia. The patella is your kneecap and the fibula is on the side. So mostly these three bones has formed the joint, that is your knee joint, tibia, patella and femur. And the lower leg bones we can say shin bone, tibia and the fibula is on the sideways, right? So now why we say, guys, like if I ask you that if I'm sitting like this way with my bones hanging over there, right? If I'm sitting like this, so I can say there is a space, right? There is a space between the bones. If my knee has been into your 90-degree angle, so I can say I can create some space between these condyles, right? But if I'm taking my knee like this, mostly what we do, so how much pressure I'm creating, see? If it is going beyond 90 here, how much pressure in between these condyles? So we have to create some space. It's not, this is I'm sitting over here, this is okay, space. I'm going like this, space. But if I'm going inside more, you can see this rolling of these condyles with each other, right? So that create degeneration, create more friction here too. You can see here that create more friction. It is rolling like this way, right? It is rolling. So it's rolling means you are creating friction and there is more degeneration of your tissues. So in between the knees here, so many other structures we have. Like if we talk about this knee joint, so the structures that consider in between the bones. So we have a meniscus here, right? The C-shaped structure that we call the meniscus. So we have a meniscus. You have heard about sometime the injuries. You fall down sometime in the sports, in the football, right? The player has some injury that the meniscal tear is there and there is a internal rotation, external rotation of your knee by chance. Then we have a cartilage, right? We have a cartilage inside. Then we have a ligaments on the sides, on the outside, front, back, we have a ligaments. Tendons. We have a synovial fluid. So many structures we have, guys. Now you can see, right? So many structures we have in between these bones. So what we have to be, that's why in the warrior 2, if the person is going like this way, right? If the person is going like this way, what we ask with the student that the knee has to be in line with your ankle, right? The center of the knee has to become in line with your ankle. If you are taking knee more backwards, create compression. If it is going more forward, creating more pressure on your lower leg, on your pelvis too. So you can see, that's why we say knee has to be in line with your ankle. Knee has not to be passed over your ankle. If you are passing your knee over your ankle, you are creating more pressure on your ankle joint too here, right? You are creating more pressure on the ankle too. So that's why we ask guys that be more careful about the knee joint, that not too much pressure over there, right? Not too much pressure that can create damage to your soft tissues, ligaments, tendons, right? Meniscus, synovial fluid, cartilage. Same with the hip. Nowadays, more problem with the knee replacements, right? The total knee replacement or the partial knee replacement because of our activity of daily living, our poor postural activities that can damage our soft tissues, cartilage destruction, arthritis of the knee joint, different shapes of the knees. So that create more damage. So if I'm talking about here now, that the common problem that we are leading nowadays for the knee joint, the knee pain, right? That is your knee pain. So how we stand nowadays, guys? Like if this is, we see, my pelvis is aligned with knee, my knee is aligned with my center of the ankle. But if my knees are going like this, locking of the knees, this is the problem. How we stand? Like this. We're standing, we are working on the standing job. After some time, this locking. So this hyperextension of the knees, this is the main problem nowadays that we are leading. That same we are doing, if you ask the beginners, go for the forward bending from here, right? Go for the forward bending. The beginners, what they try to do, this is, and they lock the knees. And as you're trying to lock the knees from here, you can see how much pressure you are creating on your lower back. So arching of the lower back create more compression on your disc and that damage your lower back and the knees too. So we must have to be careful that my knee has to be engaged, the muscle has to be engaged from here. This is not, if you're not engaging a muscle, you're damaging your joint. What you are overloading your joint, no muscle contraction, muscle is relaxed. So use the muscle, don't overload the joint. So in this hyperextension, mostly sometimes you're going for the posture like this pose, what we say, triangle pose. You're taking your knee lock. So as you're trying to lock your knee, more pressure comes to your knee joint, no pressure to the ankle, and more chances of the damaging of these soft tissues. Repeating, if we are doing these mistakes and not controlling the muscle and creating more damage to the joint, that leads to a damage. Over repetition leads to damage of your knee joint. So with this hyperextension, yes, we are doing sometimes we are asking the client, oh, micro bend your knee. Sometimes your teacher asks, push your kneecap up, push your kneecap up. So when I'm asking the simple student, like push your kneecap up, push, 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 they are trying to push it, it creates hyperextension again. The command has to be simple and clear, my friends. It has to be simple and clear. It's not only push your kneecap up, push, push. As I'm trying to push, it's going hyperextension. Simple way we have to ask, just engage your thigh muscles. As I engage my thigh muscles, my kneecap is fixed and there is no over damage to my knee joint. So not asking push, push your kneecap, push more, push more, push more, hyperextension. Engage your thigh muscles. As he or she engages, you fix the kneecap, muscle has to be engaged, no overloading on the joint. So the command has to be simple and clear, right? So this is the way to damage, how we can damage or how we can prevent our knee joint. Standing, you bring an awareness. I don't have to lock my knees when I'm standing. Engage the muscles. So not only I have to use the block here, not only I have to micro bend the knee. Yes, these are the preventions. When I am doing postures, as I go back, yoga I am practicing 1 hour, 1.5 hours a day. After that I have still 15 hours, right? What I am doing, balancing. So we have to give some preventive exercises to our students, right? Just suggest some preventive exercises to our students that, yes, I am getting some prevention during poses, but after that, I have corrective exercises. So I can maintain a muscle memory in the brain, releasing the pressure from the joint and using a correct muscles. So there are some exercises, guys, for hyperextended knees. So the exercises for hyperextended knees or generalized knee pain. Straight leg raise, 10 seconds hold into 3 to 5 reps, the repetitions. Squeeze block or pillows between the thighs. The repetition and the hold time is same. 10-second hold, 3 to 5 repetitions. The quadriceps drill that we called heel slide. Heel slides. 3 to 5 repetition. Mini squats. Seconds hold into 3 to 5 repetitions. Standing on one leg. Seconds hold, 3 to 5 repetitions. So these are some corrective exercises, guys, right? That we can use for hyperextended knees or for generalized knee pain too. So how to do these exercises? What are the precautions which we have to take? That's what I am going to show you now. So before, first we have to lay down on your back. The first one which we say, the straight leg raise. So straight leg raise you are doing this way, straight leg raise you are doing this way, but if you have hyperextension, slightly micro bend your knees. Right? It has not to be hyperextended again. Straight leg raise, slightly micro bend, lift your toes up, hold it for 10 seconds. And then release. Same you can do with the other legs. So in the straight leg raise, no hyperextension, slightly micro bend, control the muscle, lift your toes up and hold it, maintain the strength on your quadriceps. The second exercise which we can do, if you have a block, you have a pillow, you have a cushion, you have to bend your knees, place it between your thighs and try to squeeze the block or the pillow and just feel the muscle contraction on the front part of your thighs. Hold it for 10 seconds. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, release. Right? If you want to train your quadriceps with your abs, you can do it here and try to squeeze it. And lift your toes up, hold it. So ab strengthening plus quadriceps strengthening. This modification also we can use. For the quadriceps drill, you have to take your one side out of the mat slightly. So one side out of the mat, just try to slide your heel. Quadriceps drill. Slowly, slowly, slowly and slowly. Then again slowly, slowly bend. Then slide your heel slightly, slowly, slowly and slowly. You can feel the muscle contraction, muscle engagement, and don't do this. If you are doing this, again hyperextension. So slightly you can control the muscle movement. Don't completely extend your knee. If you have a hyperextension, slightly flex it and then go back, slide your heel back towards your hips and then slide your heels away from your hips. So this is the quadriceps drill that we can use. Then the next we come to the mini squats, guys, right? So for the mini squat, how we have to do this mini squat, this is the first most important thing, that how to do this mini squat. So mini squat is not only considering your knees is throwing away from the ankle, wrong. That's why we use mini squat. If you have a wall, you can use the help of the wall, just slightly go like this, knee has to be in line with the ankle. Up to here, no problem. Just feel the muscle contraction, lift your toes up, you can feel your thigh is like an iron. If you want to take away from the wall, just make sure you have to sit from your hips. Don't sit on your knees, this is wrong. You have to sit on your hips, knee has to be controlled, and try to sit on your hips. Only mini squats, not a complete squat, to feel the muscle contraction. This we can do it. Then the next exercise which we can do it, standing on one leg. So the standing, the leg which you are balancing, if you have a hyperextension on that leg, slightly engage the muscle, micro bend your knees. Hold it for 10 seconds and then release. So it has not to be go back. If it is going like this, locking knee, wrong. Slightly engage the muscle, hold it for 10 seconds, balance. It increases your proprioception also. You can check your which side is weak, which side is strong too. Right? So this practice also helps you for muscle activation of your knees and for your proprioception of your right side to the left side too. So these are the exercises which we can use for hyperextended knees or for generalized knee pain too. If you have a sitting jobs, standing jobs, 8 to 10 hours a day, never forget to practice these exercises to make your knee more stronger. And that exercises will help you in your yoga poses too, in the standing postures. If you are doing these exercises, standing postures are more easier for you. Balancing postures will be more easier for you guys. So I hope this make little bit sense how we can prevent the knee damage in yoga and the activity of daily living. So make sure always has to be happy knees, not to be in the painful way. Try to engage your muscles, how to stand, how to sit, how much you have to take. It not has to be taken too much. Like if you are going, sitting like this way, again damage to the knees. Doing this, cross legs sitting, damage to the knees. I can ask my student, has to be 90, away from 90, okay. But the knee has not to be crossed beyond 90s. This way if you are sitting, see how much damage we are creating on the medial side, the inner side of the knee. That's why this imbalances comes to your daily life. Then if you go to the yoga poses, yoga practices, any kind of sport activities, after 1 day, 2 days, you feel knees are losing their control. No balance, pain, discomfort, and more burning sensations. So practice these exercises. Awareness must needed, how to stand, how to sit. In the yoga alignments, we have described in all the yoga poses, in relation to the anatomy, how to prevent your knee joint. I hope this must be clear to you guys. Till then, take care of your knees, be happy, stay safe, stay healthy. Namaste, have a nice day.